And I will now pop the slides up.
So while you're doing that, I'm just going to introduce myself. Can you hear me okay? Because it's quite loud in the background. Can you hear the background noise? Because I'll ask them to be a bit quieter.
Yeah, fine.
Let me just ask them to be a bit-ish quiet. Hang on a minute. There's nothing like trying to multitask, is there?
Absolutely. Slides are up.
Okay, so I'm just going to tell you who I am. And then there's probably quite a lot of people. So did you go round the room and ask everybody last time who they were? Or we
did in the last one, yeah.
Is there too many to do that? Can I just check how many we got on? It might be helpful.
People.
Do you want to do that then, just quickly? So my name's Sue Gibbons. I'm the DCO for Kent to Medway. Can you hear me still? Sorry, I leant on something. I'm the DCO for Kent and Medway, but I'm also got a seconded role for 2 days a week doing regional send advisor for NHS England, and I also chair the SE19 DCO DMO forum here in the south of England. So, do we want to go around the room? I'm just going to pick the list of people. Ali. Ali, do you want to say who you are? No? Andrea? Andrea Burns, you're on the call. Hi, you. I'm going to pick on you. Tell everyone who you are. No, it isn't great.
So my name's Andrea Ferns, and I'm a nursing professional manager for SEND for 3 days a week for that team. Work as a designated Surrey Heartlands ICB. That's 2 days.
Thank you. Stephanie Askew.
Hi there, I'm Steph Askew. I'm a SEND advisor in the SEND Strategic Improvement team at Norfolk County Council.
Hi.
Hi.
Amanda X.
Hi, I'm Amanda. I'm an Assistant Designate Clinical Officer for SEND in Hull and North East Lincolnshire.
Hi, welcome. Claudia Dobson.
It's Claudia Dobson. I'm the DCO for SEND for South West London. I'm based in Wandsworth.
Hi. Laura.
Hi, I'm Laura. I am the SEND lead for the 0 to 19 service in St Helens.
Hi, pleased to meet you. Clive?
I'm the DCO in Lancashire.
Hi, Clive. Nice to meet you. Sarah. No, Caroline Hart. Hi, Caroline.
Hi there. Yeah, I'm Caroline Hart. I'm the DCO in Buckinghamshire.
Thank you. Sharon?
Hi, I'm Sharon Herbert. I'm the Associate DCO with Lincolnshire ICB.
Well, we've got a lovely spread of people, haven't we, across the country. Camilla?
I'm Camilla Hutchings, DCO in Somerset.
Oh, another area of the country, Ruth. Hope it's sunny down there today.
Yeah, I'm Ruth Cummins. I'm a designated clinical officer for North East North Cumbria ICB, covering the Tees Valley area.
Hi. Charlotte?
Hi there, I'm Charlotte Macbeth. I'm the DCO for Physical Health in Gloucestershire.
Oh, that's an interesting one, physical health.
Yeah, there's someone else that does mental health, that's why.
Oh, that's good. Never thought to split it like that. Bridget?
Hi, I'm Bridget Price. I'm the designated clinical officer for Devon, and I'm Plymouth facing in my role.
Good. Dawn Robson?
Hi everyone, I'm Dawn Robson. I'm the Designated Clinical Officer with North East North Cumbria ICB. Gateshead, please.
Hi, Hermione.
Hi, I'm Hermione Ruston. I'm the DCA for Barnsley.
Hi.
North South Yorkshire.
Did I forget anybody? Okay. So I really wanted this to be a little bit of a conversation rather than me speaking at you the whole time. Some of you might have heard this and pieces of this before. This was something that's been sort of in the development over the last couple of years, really. And I presented at one of these conferences a couple of years ago to really try and get a sense of, is this something that we all need? So I'm really pleased to see that everyone's here today. And I'm sure in the first session there were just as many people that attended, because it just gives me that assurance that it's definitely something we need. So what was the reason and rationale for why we prioritised in the South East region this training framework? We were really aware that we had a large organisations with multiple teams without a consistent training offer in a large geographical area. We really knew that our individual DCOs had not the capacity or the, there was high expectations of what we were delivering from a training perspective. And what we wanted to do is empower those professionals and providers to be able to have a framework for them to have their knowledge and competencies met to be able to deliver depending on what their role is. Next slide, please. So basically we took several phases, and it seems to be going on and on, but we're almost at an end point, is that we wanted to really think about the safeguarding assurance framework and make a framework that was very similar for SEND. So making SEND everybody's business, making sure that professionals didn't have to think too much. So whatever level they are in safeguarding training, we're asking them to be at the same level of the SEND training assurance framework. And we set out to begin to write what those learning outcomes were over the levels 1 to 5. So we're going to talk about those levels in a little bit. Basically, levels 1 to 3 are operational levels. So, level 3 is predominantly those clinicians, and then it goes up to specialist roles. What we really identified as we were writing that was that there was a real lack of basic awareness training at levels 1 and 2. So we went about consulting with NHSE to try and get some money to try and do something about those gaps. Next slide, please. So we went about exploring what national frameworks were out there, what the health workforce was, what sort of curriculum we needed to support those levels 1 and 2. We know that at level 3, there's lots of centrally funded things that the CDC and others do really well at. So some of that training that we have around outcomes or, high level strategic elements, but actually from the learning at those lower levels, we wanted to really try and get a co-produced piece of work together, which we did really successfully with parents, children and young people's voice in there. And some of you might have been party to some of that curriculum building, because we didn't hold it within the South East. We went out nationally for people to put in their 2 pennies worth to build those curriculums. So in the South East, we then took on a pilot with our health systems across community, mental health, acute and primary care providers to pilot those levels 1 and 2 and really understand the analysis of whether we got it right, if you like. So we'll explain to you a bit about that analysis in a minute. We also at this point really wanted to consider, is this a national framework that we want NHS E and I at the time to see whether they would take it towards a mandatory training requirement. So we're here today really to express to you all that we would really like some further evidence of whether the impact of having these in your systems gives us enough feedback to propel that to the next level. Next slide. So we have published the level 1 and level 2 e-learning on the CDC website, and I've put the link here so that you've all got that. And the framework itself, the whole document, is also available on the website, and I've given you that. Next slide. So in the document, I've just picked out some of the things that are in the document, but it is fuller than the slides I've picked out. We describe those levels 1 to 5. So level 1 is around all staff, so non-clinical staff, anybody entering. So really an induction type of e-learning package that's for an hour. It has case studies and like a workbook that you work through, and we've got some really positive feedback from that, and I'll share that with you in a minute. And then we've got an hour and a half of e-learning at level 2, and level 3 and 4 we'll go through in a little bit more detail, but our level from the designated clinical officers and medical officers that are on the call, that's our level of competency that we'd like to achieve. Next. Oh, it's a bit tiny, isn't it? We will give you the slides, and if you click on the link, you will have this document in full, and this is taken from the document. So when we've explained within the document on the framework the learning outcomes, we've summarised it at the back of the document, so it's much clearer for staff, and it gives you the suggested methods of training. So the requirements at level 1 are that we expect that to be an hour over a 3-year period. And as we said, that is about induction. It gives you what the competencies that we expect to be delivered at that level, and then the suggested methods of learning. And we've given the link so it's easy for organisations to give that to their staff. The level 2 is the hour and a half we talked about, and is an extension, and might be some of those staff that are supporting, so assistant physiotherapists, for instance. It might be staff like children's care navigators, if you have those within your PCNs. Those type of staff we would be expecting to be at levels 2. Next. Level 3, so this is the majority of those qualified clinicians that would be assessing and planning and reviewing care. And they'd be allied health professionals, health visitors, school nurses, all of those sorts. And we'd expect those to do 4 hours over 3 years. Now, when we say 4 hours, it seems quite a lot, but a bit like the safeguarding assurance framework, it's an amalgamation of hours. So when you break it down, it's just over an hour a year. Now, it might be that you can combine your CPD with this that hour. It might be that you could use clinical supervision or safeguarding supervision if you were talking about a child from a learning disability, for instance. You could use that as evidence that you have improved your practice and what the learning came out of that. And we've also suggested other training resources to be able to support that 4 hours. And it would be, you know, within the DCO's gift to decide maybe that you have some conference, or you have a learning package that can go in conjunction with whatever your local area need is to support some of that 4 hours. Okay, next. Then levels 4 and 5. So levels 4, we know that there is actually some gaps, and we're working with the Council for Disabled Children, alongside some money that we're having that's come down from the national team to work through what that might look like. And I know some of the other areas in the country are doing this too. So we're joining together to see how we can get the voice of those people who may be undertaking level 4, which could be some of our new ICB strategic leads, our exec leads, or senior responsible officers for SEND, and what they require to fulfill and ensure that they've got the competency to support this workforce. Yeah, that's fine. So just to assure people that we did a co-produced piece of work. It wasn't led by professionals totally, and we really gained that voice through CDC about their curriculum building. Next slide. I just thought I'd give you a couple of slides about the analysis of the 6-month pilot around those levels 1 and 2 to give you a flavour of what was the outcome. We maybe didn't have as many professionals as we hoped to join that, and that's because I think we were at the tail end of the pandemic, and as we know, capacity to be able to support additional elements of work is challenging for all of our frontline staff. But what we did do was try and use the level 2 to see if our level 3 category staff found it helpful. And actually what was evident was that, oh, hang on, I won't go into that yet. I'm just going to say that the survey, so we surveyed the before the training, immediately after the training, and 3 months after the training. And the response for those surveys was pretty much high. So, so we've got a good analysis of those professionals that undertook the pilot. Can we go on to the next slide? Because this is the analysis of level 1 and 2. So what we found was that within level 1, even though there was a small cohort, we had an increase of 30% of increased understanding, awareness and confidence in their ability to be able to think about and talk about SEND, and their increased knowledge was specifically around the code of practice and the SEND local offer. What we hear from parents is that if only I knew about the local offer at the earliest opportunity, that would have really helped me, but nobody told me about it. And so we felt that actually that really satisfied some of those things that everybody in the organisation should know about. Level 2, like I said, we asked level 3 practitioners to undertake it from the perspective of, were they going to learn and increase their understanding and confidence? And actually, there was a higher increase in learning and understanding, up to 36%, and that was sustainable to 34% after 3 months. So we know there's sustainable knowledge base there, which is also really positive. The largest increase in knowledge at this level was around the process of notifying the local authority, those key principles around co-production, inclusion, personalisation, and the local offer as well. So consequently for us, we felt that in the framework, we have added that level 2 could be useful for any staff that are coming in as a newly qualified or a new member to the organisation as part of their 4 hours. So they would be a level 3 practitioner, but they could use level 2 as part of that 4 hours. Does that make sense to everyone? I hope so. And we'll have some questions. I'm just going to ask everybody to be quiet a little bit because they've increased their volume. Hang on a minute. Sorry, we're all getting very excited in the office. It's lunchtime. Okay, so the analysis of the pilot really was to make sure that we had a refresher training. So that was recommended. So that's how we have badged our time scale. So we're asking level 1 to do that 1 hour, but repeat it after 3 years, and the same for level 2, level 3. So it's a repeating, increasing your CPD. Next. So what we're doing next, well, one is I wanted to present it to you all so that you've got it. It's freely available training. It's freely available, the framework. You can use it, you can amend it, you can do what you like with it, but it's there for you to have and a resource for your local areas. We are in the Southeast now going to develop a comms plan to make sure we launch this. Everyone hears me talking about it, but actually we need a considered way of doing that. And what we're hoping is that I'm working with NHS Education England to make sure that the platform is and is compatible with ESR, so we can monitor it from an assurance perspective. We are gaining data from CDC, so there's a little questionnaire right at the beginning that tells us who's completing it. You don't have to give your name, but professional status and the area of the country that you work in. We've had a really good uptake since it's only been live a matter of about 3 or 4 weeks now, and we've had a big increase in people accessing it. So I'm hoping this forum will give us some more perpetuation on that. And obviously we want senders being everybody's business. So my vision for the future for this is to make it mandatory, like the Safeguarding Assurance Framework, and so that we can get this as a mandatory framework nationally. That's the vision. I think that was my last slide, I'm hoping. Yeah. So how long have we got to talk? And anyone got a question? So I've rattled on long enough. Any questions? Okay, let me see on my list. I think Amanda was first.
Hi, how
Hello.
long are you anticipating it to take to make this training mandatory, really? What steps are you needing to go through? I used to deliver safeguarding training levels 1, 2 and 3 in an acute health trust, and obviously now I've changed roles. And my only perception of this training is that that's going to be the hardest challenge, is getting it to be mandatory and getting everybody on board with it.
Yeah, I think the first steps we're definitely taking are trying to do contract variations with our providers to get it embedded in that way. So because from a national perspective, because of the priorities of the Green Paper at the moment, that's why Lorraine has asked us to gather more intelligence about the impact that the training offer is having locally. So I'm agreeing with your challenges. I don't think it's an easy thing to embed at the moment, but I think it will and does very much dovetail with those areas that maybe have written statement of action, that where training has been problematic in the past, and also you know, the new inspection framework that's coming out next year will really support your areas in having a really robust way of making sure that your staff have that you know, competency to be able to deliver on send. Did I sort of answer your question? Don't know if I did. Bridget, I think you were second.
Hi, yeah, I'm Bridget.
Hi.
So one of the things that I've been looking at is like some benchmarking work around transition, thinking very much about the 16 to 25-year-old cohort. I've had very little feedback from providers. And I think the difficulty is when we think about this SEND training, I think this is excellent, and having that framework is a fabulous provision. I just think the buy-in, particularly from that adult side, is going to be so difficult because the numbers are so small. But trying to get the send message for those 16 to 25-year-olds, particularly around educational healthcare plans, all of those things, you have to excuse me because I'm full of cold.
You are, bless you.
You know,
I think you're right. I completely agree with what you're saying, but I do think that we ought to think, I think that is one area that actually has got the greatest gap in their knowledge and understanding. And so I'm thinking, you know, your local implementation of this framework could be, because my thoughts are how I'm going to be doing it is really targeting some of those adult providers that learning disability teams, making sure that I'm targeting the people who are going to see those people the most, and our acute adult mental health services, those sorts of organisations that really need to have the buy-in, and working them in at level 2 first to give them a this is what you'll need to know, even if you're a level 3 practitioner. And this is what you need to build on, but this will be your go-to first, which is why we tried to think about the level 2 supporting the level 3 in building knowledge, because I think like those newly qualified practitioners and those people who are not so familiar with SEND, like some of those adult services, would really benefit from doing that level 2 e-learning.
Yeah, I really agree. Thank you.
Sorry, I realised I turned it on mute. I think it was Andrea next.
It's my usual question.
How am I going to assure that I'm doing?
How you getting on with, because I'm sorry, we're trying and influence.
You're really breaking up, Andrea, and I can't hear you. I don't know if it's, put it in the chat. Fabulous, thank you. Caroline.
Yeah, you've mentioned putting it in contract variations. Have you got a kind of level that you're of expectation? You know, are you thinking that actually the expectation? Because I think the buy-in is the biggest bit, isn't it?
Yeah, absolutely. I think I'm definitely going for children's community providers first, and my adolescent mental health services.
And are you thinking though, like you'll say 70% of people should have done it, or are you thinking, you know, have you got any thoughts on that? Yeah.
Well, I'm going all big. I'm going 100% for level 1 defo. Right. I think it is. I think the consideration with the capacity issue at the moment, because we've all got it, haven't we?
Yeah.
Is the difficulty. But if we don't start somewhere, and I think we've worked so hard on trying to get this so that if everybody is saying the same things across all of our systems, and we're using a very similar model framework to be able to be supporting, because I think a lot of our challenges is that, you know, you for parents, they say, don't they, they're not making reasonable adjustments, because a lot of the level 1 and 2 stuff is about reasonable adjustments. We're not being listened to. We don't know about the local offer. You know, those things are really important to them, and that to me is could make that step change. And actually, in sense, reduces complaints. How long does one complaint take for an organisation? Whereas if we actually get their staff trained to be able to deliver those reasonable adjustments, they won't have the complaints, which means it works in different ways to be able to release capacity, doesn't it? To be able to give you, and we all want a better experience for our families. We're all working towards that, aren't we? In every single provider. And if this gives you a better, it gives you, I don't know about your areas, but certainly, you know, it doesn't matter how much I publicise the local offer. There are still
Nobody
clinicians
ever
that
knows
do not,
about it.
that just don't say it when they're in front of parents in a clinic room and you're like banging your head against a brick wall. You don't need to know it. You just need to know where to send them to know it. You know, and a simple thing like that, how much of a better journey will parents have from a practitioner doing an hour of e-learning? That's how I see it. You know, it's just trying to play it the right way to them, but it's a challenge. I don't disagree.
Thank you.
I'm just going to go into the chat and see what Andrea's saying. How are you getting on with managers being able to check who has completed this training so that each provider can have assurance around the numbers? Yes, so this is what I was talking about Health Education England supporting us with getting the CDC compatible. I am not an IT person. I do not understand how it is, but apparently they are working behind the scenes to try and get it on our NHS e-learning platforms that can then link to ESR. So your organisations will say, yes, that's the e-learning we want for our practitioners within our provider, blah, blah. I'm not a tech, but
Have you got any idea of timescale on it though?
do you know, I've got a meeting with them. It's not next week, it's the week after. So so he's going to give me an update. I don't know at this point in time, and he really couldn't give me anything when I spoke to him last. So I'm regularly meeting them. So it hasn't gone away, Andrea. You'll be very pleased to hear. It is something that I'm continually trying to you know, get moving. Let me just see. There was one other person. Ali, was that you who's got your
Yeah,
hand
that
up
was
now?
me.
Hi, Ali.
Hi there. Just a question about Oliver McGowan training,
Yes,
which
absolutely.
obviously is coming down the line as a mandatory responsibility from April next year.
Yeah.
And whether the case to make this statutory might get all the timing of this is going to get scooped up, and the challenge will be how much is it covered in Oliver, and then of course the providers going, because it's quite significant time. It's two things that are going to land at once, and that might add to a negative.
However, what I would say is,
how are you dealing with that?
Level 3, if you look at the form, if you look at the, when I send you the link to the thing, when you look at the whole training issue, Oliver McGowan can be part of your level 3. So I know that Oliver McGowan is supposed to be everybody, but it can be part of those hours for your level 3 competency. But what we're doing is actually we're giving the responsibility to the providers to make their own judgment on that, like we would do for safeguarding training. It is actually a provider responsibility, isn't it? Rather than our responsibility to deliver that to them. So we've given the framework, as in, actually, if you're having Oliver McGowan, that might satisfy some of your hours towards your 4 send hours. And it's trying to integrate the two, not have separate. Does that make sense?
Yes, that's good. And if it's the messaging, I think we'll need to be really careful, because I know, whilst I know that providers are very nervous about the demand for their staff they recognise the heart is there, but they're very, very concerned about it getting into the TNAs and all that.
Yeah, and so you're right. What I've tried to do, if you look at the level 3 in more detail, it was probably too small on the screen, is to say this is an amalgamated approach. This is not. So if, for instance, you had a serious case review in your area for a child that had autism or whatever, and there was a safeguarding event that gave feedback on your serious case review, you could use that as part of your CPD for your 4 hours for send, as well as using it for your safeguarding. So we're not saying the safeguarding is separate to the send, because the things interrelate, don't they? But I think it's just giving your providers a sense of assurance that you've got that you know, your organisation has a framework to be able to ensure that your workforce has got that.
I'm also thinking about all the actions that come out following serious case reviews. This is a nice concrete thing, right? Because we've learned from this.
Yeah.
Now everybody in the workforce and because it's sort of off the shelf, as it were, and it's written, that's also got appeal, I think.
Yeah. And unfortunately for us, you know, all of the governance that goes on within NHS England, it's absolutely massive. We have put it on the CDC website, but we absolutely have the national SEND team on board with this. So it hasn't been done in isolation in the south, and we haven't gone through you know, all of the regional leads nationally have seen this, have made comment on it, have made sure that, you know, we've articulated everything accurately. So it has gone through a, you know, oversight, although it hasn't and can't go through a, you know, complete governance process and have NHS England labelled all over it. But it has been seen nationally by every single regional lead. Does that answer all of the questions? What sort of timescale are we? I'm midst into this inspection and I cannot remember what time I'm supposed to finish.
We've got 2 minutes.
Oh, I've done really well. Usually I talk forever. So people who know me be very proud of the fact that we've done that in a timely way. Any other questions then in the last 2 minutes? And I really want to thank you so much for listening. And I hope it's a resource that you can use in your area. Feel free to do with it as you want. It's all there for you free of charge. All right. Lovely. Thank you so much. I'm going to give you 1 minute of your life back.